So the next skill is catheter care. Just like peri care, catheter care has the same steps. The only thing you're doing is with catheter care is pinching at the meatus with one rag and you wiping down 4 inches. That's a wash, and then you're gonna do rinse, and then you're gonna do dry. If you watch the peri care skills, you will see that you got a log roller patient, put the chuck underneath, and then log roll them back. That's your whole setup with catheter care. So we're gonna get right into it. How you doing, Mr. Johnson? My name is Mr. Golf. I'll be your CNA today. Before I get started on doing your catheter care, I'm gonna go wash my hands, put my gloves on, provide privacy. Good. Got it. So I provide privacy. I go get my basin. As before, when I did a wet skill, such as peri care and modified bed bath, I turned the water on, check the wet temperature. Assimilate, washing my hands, then I'm gonna put the basin in. Giving it enough time to do what? Fill up as I put on my gloves. Get my paper towel, turn my water off. Again, I wanted to fill up to what, 3? Good. Grab my water, let him check it. Good. Okay, Mr. Johnson, that's good. I'm gonna gather my supplies. So I got my towels, my wash rags. Now I'm gonna go get my soap from the clean side. Good. All right, Mr. Johnson. Good. With catheter care, you don't have to take off the the gown. Good. You do have to put your towel or your chuck underneath of them. So let's get that all set up. All right, Mr. Johnson, what I'm gonna do is log roll you over. Key thing, it's a fail if you snatch the catheter out. So a good trick when you're doing, when you log rolling somebody and they got a catheter, always turn them to you. Place your hands so you'll know where the catheter at. Place the catheter on your wrist, at least the two. Reach across. Ask them to assist you. Good. Ready? 1, 2, 3, and turn. Got it? As I turn, Mr. Johnson, see the catheter didn't move? Good. I place my towel, same space before, underneath. Make sure you don't put the catheter. Make sure you don't snag the catheter. You can see where the catheter is. When you put the towel, you want to put it right underneath. Got it? Make sure it's covered the whole buttocks. Good. Same thing before. Get your catheter, and we're going to roll him back over. Good. Got it? Now, get my towel. Place my second towel over top of his body. Good. Expose what I need. Here. Expose what I need. There. Wet my rag for wash. Apply my soap. And remember, your rag has to be soapy. Good. Simple. Pinch at the meatus. Catheter tube between the rag, and you wipe down 4 inches. 1. Get a rinse rag. Good. Wipe down 4 inches. From the meatus to the 4 inches. Rinse. Good. Pinch at the meatus. Good. and wipe down what? 4 inches. Dry. Good. All right, Mr. Johnson, you got your catheter and everything clean? Good. So what? I'm finished with that. Now I want to gather all the stuff that I placed under him, his towel. Good. Like I said before, know where your catheter is, because if you pull it out, it's a what? Fail. Ready? 1, 2, 3, and I what? Roll. Good. Tuck everything back up under him. Then I log roll him back over. Good. Get my towel from underneath of him. Good. Place all your belongings in your soul container. Take your soap, place it in its designated dirty area. Get your water. Yup. Rag. Rinse. Yup. Get your paper towels. We're going to do what? Dry. Place it in a designated dirty area. You're going to remove your gloves by pinching in the palm of your hand, 2 fingers underneath. You're going to dispose of your gloves. You're going to simulate washing your hands. You're going to come back, get Mr. Johnson his call belt in the hand. You're going to make sure the bed is what? Lowered. You're going to do what? Release privacy. You're going to document task complete.